the topic is what after MBBS. So I presume that we all have completed our MBBS. If there is any doubt, I would like to clarify it here and now. And for some reason, if I'm not able to, this is my email ID. Please contact me on that, and I'll try to uh, do some research on your doubts and get back to you. So it's a big dilemma of what to do after MBBS. Okay, so let me congratulate you all for successfully completing MBBS, and it's a big task. We should be all proud of it. What next? So many doubts, so many questions, and party is over. We have to think about our next move. Then comes this picture. I mean, it's a bit irrelevant to this topic, but very relevant to our situation. Like in India, it's the parents who decide everything for kids. Like my father wanted me to become a doctor, so I'm a doctor here. I don't know what I wanted to do, but in many of the houses, this is the situation. Our parents decide for us. But if they have not decided what you should be doing, you're lucky enough that they have left it on you. Then I found this simple diagram on internet, which will help you out to decide what you should be doing after MBBS. All the branches in this are usually conventional branches that we usually do, like sit for any of these exams like NEET, PG, AIMS, JIPMER or PGI exams. And we select any of these courses. Either we do medical courses or surgical courses. We may go for diploma, or through National Board of Examination, we can choose DNB in any of the streams. So there are many specialities with dermatology, radiology, medicine, psychiatry, pediatrics, in surgical branches, general surgery, orthopedics. There are many branches that we can select. But are these the best options? The question is that. Not always so, especially given the situation in India where doctor-patient relationship is, under a lot of strains, and given a lot of medico legal, problems arising with doctors. We are now into Consumer Act, so it's not that easy to practice medicine in India. So let us try to explore something different, something other than what we have been doing for these many years. First and foremost, we all after MBBS, if we are not willing to go ahead with this conventional path of doing MD, MS or diplomas, then we think of going abroad. Two countries which come to our mind are UK and US. These are the most comfortable and I should say most explored areas, most explored countries, and we are very comfortable giving exams and going to these countries for various reasons, because the doctor's work-life balance is good, payment is good. So first we'll talk about United Kingdom. There are various ways in which you can enter a UK medical system. Most popular ones are PLAB and Royal College Examination. Let us talk about PLAB first. Why we talk about PLAB first? Because it is the exam that you give immediately after MBBS, and you start preparing for it when you are in MBBS. So PLAB test is Professional and Linguistic Assessment Board test. It has got two parts, part 1 and part 2. Part 1 is a written exam, which has 180 MCQs, which you must answer within 3 hours. Each starts with a short scenario followed by a question. You need to choose the right answer out of the 5 possible answers given. You can sit part 1 in number of countries, including India, as well as in UK. And a lot of information about this PLAB exam is given on the website GMC Online. PLAB 2 is an objective structured clinical exam. So it is more of a practical exam. It is made up of 18 scenarios, each lasting 8 minutes, and it aims to reflect real life settings, including a mock consultation or an acute ward. Part 2 test is done in their clinical assessment center, which is located in Manchester, United Kingdom. So before you are eligible for part 1 or part 2, you should register yourself on this website GMC Online and prove that you have English language knowledge. For that, you should either give IELTS or OAT exam. So these two criteria before you can sit for MBBS, and you should have finished your MBBS. So after graduation, you register yourself on this GMC Online website and give an English proficiency exam, be it IELTS or OAT. Then you are eligible for PLAB. You give part 1. Before part 2, you have to do a lot of paperwork for visa, and then they ask for bank statement, vaccination, and all. Then you can go for part 2, which is conducted in Manchester, United Kingdom. Syllabus for part 1 and part 2 is essentially what we learn in our MBBS years, basically concentrating on acute medicine and more so on internal medicine. Let us talk about Royal College examination. I'll be concentrating on MRCP because that's the exam which I have given. I know more about it. There are various other Royal College examinations for various specialities, like for obstetric gynecology, for pediatrics, for pathology, for radiology. They have these exams, and information can very easily be obtained on their websites. So MRCP is conducted by 3 universities, by Royal College of Physicians of Edinburgh, Glasgow, and London. And this is a bit of statistics that they have given on their website. So it is conducted in 40 plus countries, and more than 25,000 candidates every year give this exam. They this MRCP website, they conduct more than around 15 examination, MRCP being one of those. They have exams for specialty trainings also, like for endocrinology, for gastrology. They have they also conduct exams. This is a flow chart of medical education system in UK. So I'll try to decode it in Indian language, Indian system. So the first circle that you can see is foundation year, that is of 2 years. It is equivalent to internship in India. So after you have graduated, like after you have done MBBS in India, the same way, if once you have completed graduation, medical graduation in United Kingdom, you enter foundation year. So from India, if you have completed PLAB, you can enter in this circle, foundation year. So it is of 2 years. After that, after completing 2 years of foundation course, if you wish to choose internal medicine, then you enter the second circle, which is of 3 years, starting from the stage 1, stage 2, stage 3. So it is ST1, ST2, ST3, 3 years of training of internal medicine. And at the end of these 3 years, you are supposed to give your MRCP exam. You should finish off with your MRCP exam, then only you can go ahead. So if you complete PLAB in India, you enter foundation year in United Kingdom. And if you complete MRC examination in India, you are eligible to enter in the next circle. So if you complete MRCP exam, you save 3 or 4 years of your education in United Kingdom. But it is slightly a difficult exam. They ask you more of internal. We will talk in detail about MRCP exam structure in next few slides. So after you have finished 3 years of internal medicine, then you enter specialty training, which is of 4 years, starting from ST4, 5, 6, and ST7. After these 4 years of specialty training, which involves gastrology and cardiology, pediatrics, not pediatrics, chest medicine. Pediatrics, the route is slightly different. For pediatrics, for ophthalmology, obstetric gynecology, the route is slightly different, but in a similar way. So after these 4 years of specialty training, you give an exam which is called CCT, that is Certificate of Completion of Training, and then you can practice as consultant in UK. So this is how their structure is. So after PLAB, you enter foundation year 2, and after MRCP, you enter anywhere in ST2, ST3 stage. You can enter. I mean, there are various other things that they look into before they take you. So MRCP exam has got 3 parts: part 1, part 2 written, and part 2 PACES. PACES is practical exam. So part 1 has got 2 paper, 3 hours duration each, 100 multiple choice questions. You have one best of 5 answer. So in unlike USMLE, in MRCP exams, of the 5 options that you have, many of the times, not most, many of the time, all 5 answers are right, are close to correct, but one of them is best in your situation. So like MRCP exam is post MBBS exam. Somewhere in for India, I would say you are in internal medicine. So the answer has to fit your situation, your position. So if a question comes on acute myocardial infarction, and there are options that what is best for this patient, and the options are like, you'll call cardiologist. Second option is you'll take patient to cath lab and do angiography followed by primary angioplasty if feasible. So probably for you, the best answer would be calling a cardiologist or preparing a cath lab or activating the cath lab, something like that. They will not expect you to write doing angiography and angioplasty. That would not be the right answer. So that is one thing which we have to know. And there are various platforms on which you can go through these MCQs. Like 2 platforms that I can remember are On Examination and Pass Test. They give you a lot of MCQs to practice, and when you solve these MCQs, you get the idea of what their line of thought is and what answer you should mark to get the right answer. And there is no negative marking, so you are free to use your imagination in this exam. Part 2 written is in similar lines. So for part 1, the syllabus is basically what we do in MBBS, concentrating on medicine, but they ask you psychiatry, dermatology, radiology, everything. Few questions from statistics, genetics, everything is included, anatomy, physiology, biochemistry, but more of internal medicine questions. Whereas part 2 written is basically concentrating on your knowledge of internal medicine, and more so of applied knowledge of internal medicine. They will not ask you one-liners. Every question will be a case scenario, and then at the end of the scenario, you'll have a question. It is also 2 papers, 100 multiple choice questions in each, 3 hours for each paper. And there is no negative marking here also. Difference between part 1 and part 2 is that part 2 is more of internal medicine, applied knowledge, and they have a lot of images also. So they can have radiological images like CTs, MRIs, X-rays, and they can ask questions on those. Most difficult part of MRCP is PACES, that is last part. PACES is basically a practical exam, and this the structure that you can see on the screen is valid till early 2020. From late 2020, they are going to change it slightly. So far, this is the structure of exam for PACES. They have 5 stations and total of 8 encounters. So you have 8 patients. Let us start from station 1. So station 1 will be a patient of a respiratory system and a patient of abdominal system. You'll get 10 minutes for each. So they have they give you 6 minutes to examine the patient, collect your thoughts, and 4 minutes for Viva. Just for example, I'll give you one case scenario. The one that I had got in my respiratory system, it was a patient of breathlessness of 20 years duration. Examine the patient. That is all they give you. So I had an elderly gentleman with reduced breath sounds bilaterally and reduced respiratory movement with fine crackles somewhere occasionally. Basically, it was a case of emphysema. So you have to examine the patient. After examination, for which you'll get 6 minutes, they'll ask you questions. Like they can ask you what your diagnosis is, how you reach the diagnosis, how will you investigate the patient, how will you manage the patient, like that. all these we have been doing in our medicine training, but one thing that we should try to do is that the one thing that we usually don't do in our Indian setup is that before we start checking the patient, we go through the file, or someone, be it our senior or teacher, gives us the diagnosis. So this is the patient of rheumatic heart disease, mitral stenosis. Take history and examine the patient, and there you lose your blindness. So you're not blinded, and you try to correlate everything that you find in the patient with your diagnosis that you have already been given, uh, which is not the case in PACES. So I'll suggest you all, if you're preparing for MRCP PACES, then whenever you go and examine a patient, you should keep yourself blinded. Don't look into the history or exam or file of the patient. Don't try to go for the diagnosis. You examine the patient, come to a conclusion, and then you go ahead and cross check whether you're right or not. That's why you can, that's how you can practice, because in these stations you only get 6 minutes to examine the patient and come to a diagnosis. You don't have to ask any questions to the patient about history, so it becomes slightly difficult for you to get what actually patient has. So station 1 will have respiratory and abdominal patients. Station 2 is history taking. They'll give you a case scenario. Usually the patients are trained actors. You'll ask questions, they'll answer you. They are usually healthy people. So it could be a case scenario like, this 30-year-old female has come with headache of 3 months duration. Kindly take history and come to the conclusion. So it is 20 minutes. So you get 14 minutes to talk to the patient, 1 minute to recollect your thoughts, and then 5 minutes they'll ask you about your diagnosis and or your approach about this patient. Station 3 is similar to station 1. There are two patients. One is cardiovascular system, one is neurological system. Station 4 is communication skill and ethics. Here you get a clinical scenario where you have to talk about either consent, taking consent from the patient, or a scenario could be that you have administered a wrong drug to the patient, or wrong doses, or the patient is not happy with your treatment, or patient wants discharge against medical advice. These case scenarios they'll give you 14 minutes to talk to the patient, 1 minute to recollect your thoughts, and for 5 minutes they'll ask you. So there are various ethical principles that you should go through when you are preparing for PACES for this station. Station 5 is brief clinical consultation. You'll have two patients, 10 minutes each. These are usually multi-system patients. This station is the most difficult one. You get 6 minutes to take history, examine the patient, come to conclusion, get a diagnosis, explain diagnosis to the patient and treatment to the patient, along with follow-up. In 6 minutes, you have to do this much, and 4 minutes they'll take your viva. This is, I mean, you don't have to do everything in detail. It is very concentrated history taking and focused examination that you do in these situations or scenarios. So this is more so about PACES. So like what we do in Texila American University, we train students for Royal College examinations. So various examinations that we train students for is MRCP, MRCS, MRCOG, for radiology, pediatric and child health, and also for emergency medicine. So this is how we help you with training of MRC exam, Royal College examination in this university. We provide you with all the materials that you need and help you out with patient management and practice on patients, and mock tests also are taken. So what is the benefit of going to UK? Most important that these degrees are very prestigious. They are recognized all over the world, and be it UK or you come, if you choose to come back to India, these degrees do hold a lot of value in Indian setup also. If you are practicing in UK and you get paid well, and your lifestyle is also far better than what is there in India. Now let us talk about United States. So first thing, most important thing that we should do when we are planning to go to USA is give this licensing exam, that is USMLE. It is given after MBBS. But you should start preparing for USMLE from your second, third year of MBBS only, because step 1 is the exam which tests your knowledge about basic sciences, be it anatomy, physiology, biochemistry, pathology. They have genetics, geriatrics, these things in step 1. Step 2, CK, that is clinical knowledge, is basically exam of internal medicine. Step 2 CS, that is clinical skills, is case scenarios that they give to you. It is more of a practical exam. Step 1 and Step 2 CK are conducted in India, but for Step 2 CS, you have to go to United States. And it is very helpful if you do some observership or internship in US for a 3 or 4 month duration before uh, uh, going to step 3, because that will help you in getting a better branch or better university. So this is taken from their website. In both these step 1 to CK to CS, we should look at the last dotted point. That is relevant, a graduate of a medical school outside the US and Canada listed in World Directory of Medical Schools as meeting ECFMG eligibility requirements and meet other ECFMG criteria. So basically, you have to first look into this directory to see whether your MBBS college is there in the list. Most of the colleges from India are in the list. The colleges basically which are MCI recognized are in the list. So almost all MBBS graduates from India can give USMLE. Few colleges from Ukraine, I suppose, are not in that list. Otherwise, other countries also are in that list. Step 3 is basically matching that they do depending on what your choice is and what you're getting in USMLE. So here, how many times you can give those steps is given on that website. I've taken it from the website only. You may take the same examination no more than 3 times within a 12 months period. Your fourth and subsequent attempts must be at least 12 months after your first attempt at that examination and at least 6 months after your most recent attempt at that examination. If you have passed an examination, you are not permitted to retake a step. So, step 1, step 2, clinical knowledge, and step 2, clinical skill. Any of these 3 steps can be given in any order, but you should remember that once you have passed one station, you cannot retake the exam, and scores do matter in these exams. So you should prepare well before you appear for the exams, because you cannot reappear once you have passed. If you fail, you can do that. What are the benefits in United States? We all know United States is one of the best countries for doctors. They pay you well, and you have a lot of respect there. Now let us talk about few options in India. So we have talked about UK, US. Similarly, similar to US, you can go to Canada also with USMLE. Similar to UK, there are exams conducted for other countries like New Zealand and Australia, and you give their entry level exams, and you can enter those countries also, like what we just discussed about United Kingdom. So in India also there are various fellowships conducted, and eligibility criteria is post MBBS. So there are many government bodies or private hospitals which run these diplomas and fellowship courses. Like many private hospitals, like Apollo Hospital also has got many fellowships. These fellowships are in various branches like critical medicine, emergency medicine, child care, obstetrics, diabetes, anesthesia, to name a few. I mean, there are many branches that you can take fellowships in these. One example is Maharashtra University of MUHS Nashik, which conducts various diplomas and fellowship courses post MBBS, and you can go on this website to look into the details of each. Next is this Academic College of Emergency Experts. It is a certification examination that they give, and that you can give post MBBS, and you get the certificate of emergency medicine from this organization. Next is Indian Society of Critical Care Medicine. this side, mind it is not recognized by MCI, this degree, but eligibility criteria is MBBS or equivalent. It is 2 years course, and you get certification of critical care medicine. Various fellowships and diplomas are also conducted by National Board of Examination, and these are all recognized by Medical Council of India. You can go on this website and check the informations in detail. Now, if you do not want to do hardcore medical practice in future, there are other options. If you're interested in applied sciences or research, IIT Kharagpur has got a course which is School of Medical Sciences and Technology. It's a 3-year postgraduate course designed for MBBS graduates. After you have completed your MBBS, you have to give an entrance test conducted by GATE IIT, and through that entrance test they take admissions, and there are various courses like signal processing, image analysis, tissue engineering, genetics, drug discovery. They are all biomedical fields in which you can do your post-graduation. And if you're interested in joining government jobs, and these are jobs which pay you well, and you have a lot of lot of power and prestige in these job profiles. These are conducted by UPSC, the board which conducts IAS IPS examination. So they take this exam is for various posts like assistant divisional medical officer in railways, and there are various government owned factories where they post you, various jobs in Delhi, government jobs where you can get admission through this examination. So the examination is conducted once a year. Education qualification is MBBS. Age limit is 32 years. It is computer-based examination. There are 2 papers. The format is objective. It is conducted in 1 day, and you can get other information on this website, www.upsc.gov.in. So if you are interested in government job, you can give this exam. Defense services, so post MBBS you can also join force. They conduct entrance exam. For Mumbai, it is conducted in INHS Ashwini. It is conducted once a year, and you all know the perks of joining forces. You have job security and various other facilities that they provide to their doctors. They facilitate you in post-graduation also. So if you are interested in research and academics, there are many pharmaceutical companies and many institutes like AIIMS, PGI, JIPMER, ICMR, and Tata Institute of Fundamental Research, where you can join various courses post MBBS. They have their exams. You can check this on their respective websites. Hospital management is very talked about thing after MBBS. So basically, after this degree, you join corporate hospitals and manage those hospitals. Do a lot of administrative work. They pay you well, and the job profile is very good. So there are many management institutes, MBA institutes, which conduct this course of hospital management. AIIMS also conducts it, but for AIIMS you have to have MBBS. For other institutes given below, you do not have absolute criteria of MBBS as your degree. Other graduates also can join. And last but not the least, self-employment through private practice or public health. Post MBBS, you have many doctors you know of, like family physicians, who are making good money. They have a lot of respect in society. So starting practice at this stage also is a very good option. I think that's all I have to talk about. If there's anything that anyone wants to ask or want to clarify or add to, is most welcome.
Thank you so much, Dr. Dhirendra. So anyone have any queries? Yeah, please do. You can ask. You can unmute yourself, or you can also post it in the chat. And Dr. Dhirendra, there is one query we have received from Dr. Ragesh.
Right.
Uh,
Yeah.
he is asking about like after passing out MRCP, what's the process to work in UK?
Right. So after you have cleared MRCP, uh, so you have to enroll yourself in. There are two job profiles. One is private, one is government job profile in UK. So for basically we all look for government jobs in UK. So this NHS website is there where you have to post your CV with your research or paperwork or anything that you have done. And individually also you can apply to various posts which are available on NHS website. And I think British Council also has few job vacancies on their websites. So you apply for those jobs depending on what they have to offer and what you want. They take your interview, uh, um, and mutually you strike a deal. I'll just give you an example. Like if you have completed your MBBS or MD medicine, you've completed your MRCP. Now you want to go to UK to do cardiology, or you want to do pediatrics. Then you will apply to these NHS websites for jobs. Jobs will be of various types. House officer jobs are usually of foundation years. So after PLAB, you enter those job profiles. But if you have completed MRCP and if you have completed your MD medicine, then you can look for job profiles which say ST2, ST3, like that. So there you work as registrars and you look for a job in field where you are interested to pursue your post graduation. Like if you want to do cardiology, you look for a job in cardiology. If you get a post in cardiology, you can apply for that. They'll take your interview, and if they are happy with that, they'll offer you a salary that is also negotiable, not to a great extent, but yeah, somewhere around 30 or 40,000 pounds per year is what they pay you, which is decent enough. And if you both mutually decide, agree to that post, you can do other process like you can apply for visa, and uh, uh, and you have to get your undergraduation verified by a site called Epic, which is necessary. After you have done all that with your job profile and your uh, graduation degree being after your graduation degree has been verified by Epic, which is a site which verifies your graduation degree, you can apply for GMC registration. With these, you can get job in NHS. After you have taken the job, you work there for 6 months to a year, and you get your competencies marked. So they will not accept your MD, like they will not accept that you know everything what they expect you to know just because you've completed MD medicine from India. You'll work there for 6 months to a year under a consultant who will uh, mark all your competencies. Like yes, he can talk very well to the patient, he can put IV lines, he can examine patients independently. There are many criteria that you'll get yourself marked. And after you have achieved those credentials, every year they have interviews for training posts. Training posts are basically the post which we get after entrance exam. Like this is a admission to cardiology, admission to gastroenterology, that kind of training posts you get. So that training post will start from ST4 to ST7 of these 4 years. Then once you have entered that training post, you'll work there for 4 years. At the end of 4 year, you give that exam of CCT. Once you have cleared that exam, you become consultant there. That's how it is there in UK. Anything else?
Thank you, doctor. And there's one more question. Dr. Shifa is asking actually his master's in public health from Australia after MBBS in India. Will it be accepted in UK? She has a question maybe in the public health domain. Will it be
I
accepted?
I'm so sorry, Shifa. I really don't know about this, to be honest. But if you want, I'll have to. I mean, you have my email ID. I'll just have to check it, and then maybe I'll get back to you with the answer. I'm so sorry, I don't know about this. Masters in Public Health from Australia after MBBS. You have completed your Masters in Public Health. I don't know. I'm so sorry. I'll just check it and let you know. Anything else?
Yes. Anyone else have any questions? Please do. You can unmute yourself and you can ask your question. And Dr. Debraj is asking, do you provide? Okay. Yes, I think I could answer that. We provide coaching for MRCP exams, doctor. Not for PLAB. Actually, we are conducting training for all Royal College examinations. I hope you would have seen in the slide as well, Dr. Dhirendra have shown. We are conducting training for 6 specialties: medicine, surgery, pediatrics, gynecology, radiology, and emergency medicine. So regarding that, I'll ask my advisor to get in touch with you to provide the details. And any other questions, please do unmute yourself and you can ask. Yes, doctor. The question from Dr. Adira is that we decide to come back. Yeah.
I get the question. See, Athira, the thing is, any training in UK is very prestigious, and it holds lot of importance and value in India. So I know many of my friends who have gone to UK, who were there for 2 or 3 years, but for some reason, maybe they did not like the lifestyle, or they were homesick, or for some XYZ reason, they came back to India, and they, in their degree, they write fellow emergency medicine or fellow surgery. So you work for 2 years, 3 years, 6 months, for whatever duration, you are a fellow in UK, and that experience does count in India. So it holds, lot of value in India. When you apply to basically, especially to corporate hospitals, they do take doctors who have experience in UK. Yeah, they do accept MRCP. I'm not sure about MRCEM, but all Royal College examinations are accepted in Australia. So on their websites, they write fellow of Australia, member of Australian College of Examination or equivalent. So that equivalent includes MRCP or any Royal College examination from UK. Can I practice? It's difficult for me to answer. I really don't know. I'll have to check with MRCP. I'm so sorry, Shifa, I don't know. Shifa, can you just just drop a message to me on my email? I'll just write my email here, and I'll get back with these answers to you. Any Royal College examination from UK is recognized in Australia, but I am not very sure about whether you can practice with the exam. You can get into various job profiles, and maybe you'll have to, at the end, before you start practicing, you have to give their exam. And so I'll have to check it out and let you know. I'll do that. Anything else?
Anyone else have any questions? Please do post it before we wind up this session. I think that's about it, Dr. Dhirendra. So thank you so much, anyone. If you have any queries, you can also anytime contact us. I will have our contact details shared to your email IDs, whatever you have registered, so you can get back to us at any time. And also, Dr. Dhirendra, thank you for spending your time and giving the details. It was very enlightening.
Thank you. Thank you so much for giving me this opportunity, and all the best to all the students for
Thank you, Doctor.
future endeavors. Thank you.
Thank you, everyone.